welcome to another of our selection of information videos. Today's is on exemption from NHS dental charges. I hope you find it useful. Claiming free NHS dental treatment. This is an option which we expect to increase quite a lot in the coming months. A lot of patients may have paid for their dental treatment for many years, and it's been quite often that I find patients a little bit concerned and sometimes apologetic that they're now not paying for the treatment. I'd like to be really clear that this is not a problem at all. NHS dental practices that take patients' charges at reception do not keep that money. That money goes to the NHS. So NHS dental practices are paid independently of what patients pay for their treatment. So the treatment and the care we deliver will be the same whether you pay for your dental treatment or don't pay for your dental treatment. The only exception to that is cosmetic or private dentistry, which is not subsidised by the NHS, and so you'll pay for that the same whichever category you're in. So private and NHS costs are different, but when you're coming for NHS dental care for health and improving the oral health, if you consider you may need exemption from costs or charges, please ask and we can help you through that process. The next slide will give some more details. So online we have plenty of NHS information and advice. There's some specific clear groups which don't pay for treatment, and when you come for a visit and either asked online with an online form or by the dentist in the surgery, there'll be a box to tick explaining why you don't pay. So for some that's because you'll be under 18 or under 19 and receiving full-time education. Pregnant women or a mother who's had a baby in the previous 12 months. Also people who have income support, income related employment and support allowance, income based job seekers allowance, pension credit guarantee credit, and universal credit for the last assessment period where there were no earnings or earnings within the allowed limit. Or you may be named on a valid NHS tax credit exemption certificate, or you're entitled to an NHS tax credit exemption certificate, or you're named on a valid HC2 certificate. Also consider you may be the partner of a claimant or a dependent person under 20. So you can see this is really quite complicated in some ways, but if you have the right evidence to show, you then can claim under one of these reasons and tick the box, and then there'll be no cost for your NHS dental care. There is some confusion sometimes on people who expect to be exempt from costs. People who have the following things won't be exempt. So incapacity benefit, employment and support allowance, job seekers allowance, disability living allowance, council tax benefit, housing benefit, pension credit, savings credit, when they're paid on their own. Medical conditions themselves do not exempt patients from payments for dental treatment. So when you make a claim, you'll be asked to show written proof of that claim in the way of a certificate or some other sort of paperwork. Checks do get made by the NHS on people who claim reduced or free dental treatment, and there is penalty charges, sometimes up to £100 or more, plus the cost of the treatment if you've claimed incorrectly. So if you're not sure, please ask our reception staff for help, or pay the normal charge, keep your receipt, and then make the claim for exemption afterwards. We do hope to be able to see you soon in the practice, and we do have paper means testing claim forms which patients can always fill in and send off if they're not sure if they should get help with the cost of treatment. So thank you for listening. I hope that information has been useful, and we look forward to seeing you in the practice soon. Quick thank you as well to my son Daniel, who set up all the equipment. I hope this video is a bit better than the previous ones. We're trying our best and getting better week by week. Bye!